I'm Jessica Williams, and today I'm going to tell you a little bit about a new toolkit that I've developed with Rebecca Anderson with funding from the Health Forward Foundation about community health workers and social determinants of health. And this is a toolkit really for organizations and managers. So it's designed to help people who are interested in improving their workforce professionalizations, outcome measurement for social determinants of health, and process improvement. Before we created this toolkit, we actually did a really extensive literature review to kind of see what other toolkits were out there. And there are some wonderful, wonderful resources that we actually highlight that tell you how to set up a community health worker program, tell you how to work out payment models, and can really help you design a particular program. This toolkit is not that. It's really for measuring outcomes and how do you improve your process and how do you keep your workforce improving in their skills. So this toolkit is really designed for people who are thinking about a program actively or who already have a program and they're trying to make it better. In each section of the toolkit, we have a few different things. One is advice on how to approach these different topics. We also share some best practices from our 5-year research community partnership, as well as from the literature. We go through some examples to demonstrate these best practices. So we tell you what we think has been worked across a variety of settings, and then we try to show you as well. And then we also list a bunch of online resources. And here's where you'll find some links to sort of other toolkits that can help you with other parts of your program. Here's the link to the toolkit. It is chwtoolkit.org. And so now we'll go to the website and we will look at that. And I'll turn it over to my collaborator, Rebecca Anderson.
One of the areas that we wanted to highlight is professionalism and training. So in this section, the things that we want you to pay attention to are defining the role. So when you're thinking about defining the role of the CHW, some things to keep in mind and be thinking about are, what do you want the CHW to be focused on? Who else within the organization would they collaborate with? Where will they be sitting? Who are some of your internal champions to make this successful? And what needs to be built into systems in advance to make this successful? So one of the things that we found, and the reason that we thought defining the role was important, is because oftentimes what people do is they will hire the CHWs and place them in that role before it's defined. And so these top of mind things that we mentioned are really important to be thinking through before you place the CHW in their role. So then when you have defined the role, you're ready to hire, the next step would be orientation. So you're ready, your CHW is hired, you're ready to orient them. So some of the things when you're defining orientation that you want to think about is the big picture of the CHW role. So what all will they be doing? What do you need to train them on? You want to think about things both internal and externally. So what are things within your organization, and also what are things outside your organization that they would be being trained on? You want to start small, things from sending emails to understanding their role. And then you want to move into more competency-based things like performing assessments, mastering those competencies. So how are they proving that they have the ability to do every one of the core competencies that are set, either nationally or within your state? And you also want to think a little bit longer term than your typical orientation. So you want to check off that they've mastered the skills that you have set before they are working independently. And we have given some examples of some of those things that we think are best for CHWs to be trained on in their role before they can actively work on their own. So then in the next section, the continued training and refinement, one of the things that you want to be thinking about here is really once you hire and place someone in a role, the training does not ever stop. So you want to be checking workflows. is what you designed the process that you want in place? Is it working? Is it not working? And what needs shifted? You would want other people to also observe this process and give feedback and then pivot your program accordingly. So one of the things kind of as a best practice that we suggest are something called skills fairs, where you would bring people in, have them be the patient, the CHW perform their duties, and then you get pretty consistent feedback. So at minimum, you could do this twice a year, every 6 months, just to make sure that your program was designed in a way that it is truly functioning and works in the way that you wanted it to.
Okay, so the next section of the toolkit is discussing sort of outcomes measures, particularly for programs that focus on social determinants of health. This is really important. So as time moves on, everyone is more interested in outcomes and they want to see them. So often with community health worker programs, it is incredibly easy to show the value by having community health workers relate stories from their patients or having patients write up sort of their story. So how did CHW help them? Those are really powerful and those are great evidence. Other times you need to provide more structured types of outcomes for funders or grantors or others within your organization. And more structured outcomes can also be helpful because they can tell you how you're doing over time in a very standardized and sort of systematic way. And so here, in this part of the toolkit, we've broken down different ways to think about outcomes and giving you some examples for different things you could cover, right? So every program is not going to address every single thing, but this can give you some ideas of the domains that you want your program to address and to continue to address. The other thing that's really important is thinking about what perspective are you evaluating your program from? And so what I mean by this is, who is the evaluation for? Are we doing it for clients? And if so, then the client's perspective needs to be the one that's centered in the analysis. You can also evaluate from sort of the community health worker perspective. So how is the job going for them? How is working with clients? Are there things that are difficult? What do they need help with? You can also evaluate things from a program perspective, and this is sort of more common, I would say, in general, where people need to see, how many clients are enrolled for 30 days versus 90, and how do we measure those health outcomes at the program level. You can also measure it from the perspective of a payer. And so this is someone who's sort of maybe funding the program or who is thinking about adding CHWs to their network or to their health system. And a lot of these overlap with things from the program perspective. Another thing that can be really helpful is if you've thought carefully about your own outcome measures, when different payers ask you to collect different measures because they like whatever the measure is, you can push back a little bit and say, we've picked outcomes that are validated, that we know are measuring what they're supposed to measure, and here's why. And often that can be really helpful because a lot of times payers just want to make sure you're collecting something, right? And so if you can show them you've been collecting consistent good measures over time, that can be really helpful in demonstrating value. You can also measure things from a community perspective and evaluate at that level. We talked through a few sort of best practices here for getting started with your own evaluation. And then we talk about how you might develop, test, and use specific outcome measures. So we go through different timelines you might use. So how long does it take to actually start using a new outcome measure? And this could be something like asking people how many times they've been to the emergency room in the past month. We can talk about how you might develop measures, how you might see if they're working, as well as talk a little bit about how you might look at some sort of internal outcomes related to those measures. And lastly, in this section, we talk about caseloads as outcomes. And so this is really interesting because caseloads are a big topic, obviously, when community health workers are involved. And because the programs vary so widely, it's really important to make sure that caseloads are appropriate for the particular program that you are running. And one of the ways to do this is to use things like outcome measures as well as process measures. So things like, how many phone calls are community health workers having to make? How many in-person visits do they have to make? How long do these visits take? Right? Because different patient populations are going to have different needs, and those are going to take different amounts of time. So while one program might have community health workers who are focusing on, 10 clients at any one time, another with sort of a less intensive model might have, 30 clients at one time. And so it's really important to think about caseloads as outcomes. And we give you some ways to sort of think through that, and also ways to talk to actual community health workers and ask them how caseloads are and get usable information from a management perspective out of that. The final section of the toolkit covers process improvement. So this is something that's really important. As you start thinking about evaluation, things change, right? The state of the world changes and programs can change. Where you operate changes, your personnel change, everything changes. And so one thing to think about is, how do you actually improve your process? How do you change it? And what we have found from research is that it's really important to actually think about this instead of just constantly be reacting to things. So help things sort of feel more organized, and ideally you'll get better results. And so what we do in this section is we talk about three different real process improvement models and one way to track them. So one is a plan, do, study, act cycle. There's Six Sigma, Lean Six Sigma, and empowerment and valuation, which we think is really useful, particularly for community health worker programs that are more community focused. And then we also go through a change management spreadsheet that will essentially help you keep track of these improvements so that you can make sure things are happening over time. The last section of sort of the process improvement section here is workflows. And here's where we're talking about the way people complete tasks. And so why are workflows important? Workflows are important because you really want to see what's going on and you want to have some standardization. So you want to know that your program is being delivered in the same way to every client. And so workflows is one way to really standardize that practice. Workflows can also be helpful when that practice needs to deviate. So if, for example, you have some CHWs who are placed in hospitals while you have others who are placed in a community health center, right? They will probably need different workflows. Having a standardized workflow is really helpful, and it'll also show you when you need to potentially deviate from that. And so this section of the toolkit really goes through some different ways to create a workflow. So it gives you steps on what to do next, how you can diagram it, things like that, and as well as giving you some example workflows. Now, these aren't meant to be used by particular programs unless they work for your particular program, but it's just an example of how workflows can change over time. And so you'll see we've got 3 different versions of the same workflow, and they look really different. And that is intentional. And having the workflows allows you to see those changes over time in a really meaningful way. The last part of the toolkit, you've seen resources in some of the sections sort of at the bottom of the different pages, but there's some sort of additional resources here that will help you with different things like continued training, looking at caseloads, and some different resources for how you move through these different evaluation frameworks. And that is all for our toolkit. I hope you'll check it out online at chwtoolkit.org. And please let us know if it's useful for you. Thank you so much.